Hi, my name is Ingrid, and today we will be learning about types of shock. Shock occurs when the body's cells are unable to generate energy as a result of insufficient oxygen delivery, usually due to a reduction in blood supply. Essentially, the circulatory system collapses acutely and is unable to deliver enough oxygen to meet the needs of the body's tissues. The cells of the body need sufficient perfusion in order to remove metabolism byproducts and produce energy, and if hypoperfusion, inadequate delivery of vital oxygen and nutrients to body tissues, is present, then the body goes into shock. Prolonged, severe, or unaddressed shock results in irreparable cell damage and organ damage, followed swiftly by death unless prompt intervention occurs. For a good outcome, it is vital that shock is detected early, the cause of the shock is identified, and adequate and immediate treatment occurs. When a patient presents in shock, stabilization and first aid techniques necessary until the cause of the shock can be identified and addressed include body temperature management, e.g. patient warming once IVFT has begun. Intravenous fluid therapy, although this is contraindicated in some circumstances. Oxygen supplementation in a non-stress-inducing manner. Intravenous catheter placement. Constant and close supervision and reassurance. Reduction of stressors, e.g. ensuring the room is quiet, etc. Comfortable bedding. A patient can experience one or more of the following types of shock. Cardiogenic shock, involving the heart pumping inefficiently. Distributive shock, including septic, toxic, and anaphylactic shock involving an abnormal distribution of body fluids caused by vasodilation right throughout the body. Hypovolemic shock, involving a decrease in the blood volume circulating throughout the body. Obstructive shock, involving the physical obstruction to blood flow. Cardiogenic shock is a result of the heart being unable to effectively pump sufficient blood around the body, and is often seen in conjunction with degenerative heart diseases affecting the heart muscle, such as cardiomyopathies. Clinical signs of cardiogenic shock differ based on the type of heart disease present, but can include tachycardia or bradycardia. Irregular pulses, including deficits. Heart murmur. Fluid therapy is usually contraindicated in cardiogenic shock, but may be used conservatively if needed. Treatment involves addressing the underlying heart disease. Distributive shock is seen when generalized cytokines, inflammatory mediators, are released that cause systemic vasodilation, usually as a result of severe inflammation or severe infection. The vasodilation to this degree occurs right throughout the body. The body cannot control how and where the blood volume is distributed, meaning that the crucial internal organs may not properly be perfused. The red mucous membranes occur as a result of the body's inability to constrict the blood vessels. Red mucous membranes are also one of the indicators that the type of shock is distributive, as pale mucous membranes are more commonly seen in the other types of shock. The treatment of distributive shock requires the prompt identification of the cause and addressing the cause, which can involve both medical or surgical treatment. In anaphylactic shock, treatment typically involves the administration of antihistamines, adrenaline, corticosteroids, and fluid therapy. Whilst intravenous fluid is indicated for patients with distributive shock, it is important to remember that complications can be quite common due to the vasodilation and inflammation of the blood vessels that make peripheral edema more likely. Clinical signs of distributive shock include red mucous membranes, rapid capillary refill time, CRT, initially and then becoming increasingly prolonged, tachycardia, poor pulse quality. Hypovolemic shock is the most commonly seen type of shock in companion animals and is caused by a substantial loss in the volume of circulating fluid in the body, such as blood, either internally or externally. It is important to consider the percentage of fluid loss, not just the volume in relation to the patient size, as a small volume of blood can be a large percentage of total blood volume in smaller patients. Clinical signs of hypovolemic shock: pale mucous membranes, prolonged capillary refill time, CRT, tachycardia, hypertension, poor pulse quality. Hypovolemia, also referred to as volume depletion or volume contraction, is a reduction in blood and/or the volume of fluid that is circulating through the body. The treatment of hypovolemic shock involves two key factors: the arresting of any hemorrhage, be it internal or external, and the rapid replacement of fluids lost, which may be crystalloids, colloids, or whole blood. Obstructive shock occurs when the blood flow is obstructed and prevented from circulating effectively. Obstructive shock is quite rare in companion animals, and treatment involves addressing the underlying respiratory or cardiovascular cause. Want to learn more? Scan these QR codes to learn more about types of shock.